Hello and welcome to the 5 practical solutions for managing high function anxiety in the workplace. My name is Holly Foxworth. In case we haven't met, I'm a registered nurse. I'm also the marketing manager for content here. I have 2 familiar faces that I know that you will definitely recognize them. We have both Dr. Cherry, who is our Chief Medical Officer, and we also have Dara Wheeler, who is our Chief Marketing Officer on the webinar multiple times before. So they're going to have some great information to share with us as we go through some of the content for today. Before we jumped into that, I wanted to bring your attention to 2 things specifically. The first one is the next event we're going to have, and we are really excited about this one. We've been wanting to collaborate with this professional for quite some time. It actually was a contact of Dara Wheeler's, but it is Dr. Anthony Galpin, and Dara, you can correct me if I'm wrong. I was thinking, is Galpin right?
Andy Galpin.
Galpin, yeah. So anyways, he is from Cal State, and he actually is a professor, but he's also the co-director for sports performance there. He also, like the list goes on and on and on of his many, many accomplishments, but he also has the biochemistry and molecular exercise physiology lab. And so he's worked very closely with many of the professionals from the sports leagues there. And so he's going to be working with us and talking through some practical solutions then for what it is that you can do with your employees to impact not only their general wellness, but also really drive down some of those injuries that may be occurring. And then we'll also pick up some of the heat, illness, and injury prevention. So the name of that actual event is Workplace Athletes Train Like Champions. So I know we'll have a great turnout for that. If you haven't already done so, the sign up and your free link to get into that is located right there at the top of your screen on the right-hand side. If you'll just click that blue button, I think it says register now, that will get you your seat. It'll send you the email and you will have a reserved spot there. Below that, there's 2 things that are right below that. First, you'll see is the box, and that is where you can communicate with us directly. You can ask us questions if you have something that you wanted to provide for input. Anything that you want to communicate about, please feel free to do so. We'll talk about it in a little bit more detail as we get into the content, but we understand that this topic that we're going through today, it can give you anxiety just talking about anxiety. So we're gonna go through all of the different factors that are associated with that. But if you have a question, you don't want your name said or shared, please feel free and just type that in the comments. It comes directly here to me, and we'll make for sure that we get that information and answer your question without having to disclose any information that you'd feel uncomfortable doing so. So with that being said, after the one box that's below that is the resource section. That's where you'll find the slides for today from our presentation deck. You'll also find the information about Tempo Live, which goes through some of the behavioral and mental health perspectives of what you may want to look at implementing within your workplaces, along with a white paper it kind of talks about from a larger view of the mental health impact that has occurred that was related kind of specific to the pandemic that was there. And that was actually authored by our Dr. Curtay, which is a new member of our team. If you guys haven't met him yet, I'm sure he'll be on the next one that follows. With that being said, we can go ahead and jump into things. I'm going to go ahead and let our panel introduce themselves, and then we'll dig into the content here. Dr. Cherry, do you want to go first?
Sure. Good afternoon, everyone. My name is Scott Cherry. I'm Axiom Medical's Chief Medical Officer. I'm board certified in preventive medicine, public health, and occupational environmental medicine. Those specialties really focus on, primary, secondary, and tertiary prevention across the host of all diseases and exposures in the workplace. Something that I would mention specifically for this topic was I've spent a number of years screening many employees working in a personnel reliability program for mental health and substance abuse. And so that gave me a lot of lessons learned about the implications of mental health symptoms and how they affect people in the workplace and in their social settings. So I'm really excited to be talking about high functioning anxiety today.
Absolutely. Well, we are tickled to have you. Dara, you want to go next?
Yes, thank you, Holly. Thank you all for joining us today, and I'm really excited about the topic too. excited and anxious, and so we'll talk a little bit about where that begins and ends, because I think it's quite a continuum of both. I'm Axiom's Chief Marketing Officer. I've been with Axiom for many years. I think I'm at 16 this year. And this topic's really, it's a great topic, and I'm excited to get through it with Dr. Cherry and Holly. But I do want to just reiterate what Holly said. Shoot questions in. We've got a bunch of people here today, and I would love to hear from the audience, hear any questions or comments, because I do think, the goal for a webinar like this, we'll talk about what's going on with anxiety and how functioning anxiety, but what do we do next? The what next question is always the way I think. Okay, great, we can recognize this, but what do we do in the workplace? What do we do for our employees, for ourselves? So great, we've acknowledged it, but now what? Thanks, Holly.
Absolutely. Yeah, definitely. Yeah, and last week, I think it was Janet, or the last webinar Janet had some great questions. I think she was the one that we had sent out a thank you gift for. So we will begin the week. And so if you would like to include your question, and we'll select one at the end and make for sure that we get that mailed out to you directly. All right, well, let's get moving then. Let's get started. So in terms of the type of content and topics that we're going to discuss, first we're going to talk about why it is that we're all here. What was it that drove us that we wanted to talk about this with you, and what was it that drove you to press the button to say, hey, I want to attend this as well. I want to register for this and attend. So whether that be something that is you personally, or whether that's somebody that is maybe in your family, or it's a colleague, or whatever it may be, we all have our individual reasons for doing so, but we do want to talk about how broad that view actually is. So we'll jump into that. Also talk about symptoms that you may identify with. And so when we say symptoms, we're talking kind of more about your feelings. Do you have certain feelings? Do you experience certain things, et cetera, that may suggest that you could be suffering from high functioning anxiety? We'll get into some of the biggest challenges, especially when you talk about the difference between diagnosable anxiety disorders versus what specifically the high anxiety disorder would be. And then we will move on to those practical management solutions. So that will be a high level view of what it is that you could do individually, but then also maybe what do you want to bring out within your organization. All right. Well, I'm going to come to you first then, Dr. Cherry, and just kind of talk us through what it is that we're looking at, what we're seeing here, and how broad is that from an anxiety perspective.
Mm-hmm. So we've been really dealing with COVID, the pandemic of COVID, the last couple of years, and one of the kind of consequences, I would say, from the pandemic was now there's been a huge shift to mental and behavioral health. And as we kind of look at kind of the epidemiology of mental health across the U.S., you could actually say before COVID, before the pandemic, there was really already an epidemic of concerns around mental and behavioral health. And so this slide is really pretty impressive to see that in a country of 350 million, 40 million adults really meet the criteria to be diagnosed with an anxiety disorder. And the number is actually much bigger that experience anxiety at different levels and on a continuum that do affect their lives, but just may not reach the criteria of being diagnosed formally by a mental health or licensed and credentialed provider. And so, this slide also shows that the impact is across all types of races, socioeconomic experiences, sex, just everything that there's really no one immune specifically to kind of these mental health challenges. And today we're talking about high functioning anxiety, which is really interesting because, like I said, I think most people are not even aware of how prevalent or how many people are actually suffering or dealing with behavioral health issues in their lives. And, this specific topic is interesting because high functioning anxiety is not a diagnosable condition. And we'll talk about the differences a little bit later. but a lot of people kind of normalize that or actually use it as a motivator. And so, again, there's so much stigma around anxiety and other mental health that we want to make this more, we want to provide awareness to where people realize this is not something that's uncommon or rare, and that, you're not alone out there. And really, this is an event that's a safe place to learn and ask questions. So just kind of trying to set the stage here for today's topic.
For sure. Yeah. And, I thank you for pointing that out about this being a safe place. I'd mentioned that in the beginning, but this really is one of the most significant things that jumped out at me whenever we were looking at some of this, and even coming into today. We all talked about the anxiety that we actually feel as well. You would think that as medical professionals that we don't ever experience any of these things, but that's not accurate. We do. We have the same feelings as what many of you have. One member of our team who we were talking about, he said, I wish I would have known that this had existed earlier in life. And so, because that would have given me so much more peace and comfort of knowing that this is what it was. These are what the feelings were that I had, and it could have made a difference in maybe the outcome or how he dealt with those individually. So I thought that was such a powerful statement. And again, we just encourage that if you have questions or you want to speak out, you want to include anything, this is a safe place, and that's what this was intended for. All right. Well, kind of, Dara, moving over to you, whenever we talk about some of these things on how it is that we might identify with that or statements that are typically associated with high-functioning anxiety, what would that include?
Yeah, I'm not going to read from the slides here, but I think Holly, it's a bit of a, I feel a bit attacked because it feels a little bit too much like myself. But I think the point in high functioning anxiety is that often it can be masked as high performance and all these other things. And it's not, and I think Dr. Kurte has made this point quite a bit about these concerns, behavioral concerns, and how we think about them on a continuum. And I do think, to Holly's point a second ago, often we're afraid to acknowledge it or call it by a name because we don't want to be diagnosed with something that we're labeled with forever. And so when we call something high functioning anxiety, it feels too much like a diagnosable thing that all of a sudden I'm going to be labeled my whole life, and now I've got to deal with that. And so I think when we think about these things and we think about the continuum of people, and I think Dr. Kurte always says this, reiterates this, just because you've been diagnosed with something, even if it gets to that level, even if you get to a level where your anxiety is a diagnosable event or a diagnosable condition, it is something that people often majorly improve upon over time. And I think recognizing it, number one, is the key. So I think when you think about something like high functioning anxiety in the workplace and how it portrays itself in the workplace, that has been such a major moment of eye-opening for me because so many of these things do present in ways that show somebody as being an amazing performer, that they're great at what they do, they show up for work every day and put everything into it. But sometimes there's this kind of flip side of it, and we'll talk a little bit about what the flip side is. But some of these characteristics are people that are very ambitious, they may be perfectionists a little bit, and they may be constantly thinking. So they're the people that say, I was awake at 4 a.m. thinking about my next idea for the next webinar, and Holly's laughing a little bit because she recognizes herself a little bit in that. And so when you work with people like that, you're like, wow, Holly was so hardworking and brilliant. She was up at 4 a.m. I was up at 4 a.m. It almost becomes this weird virtuous cycle of like all these great things are happening at 4 a.m. But now you realize, well, wait a second, that person wasn't sleeping. They were worrying or thinking, and their brain wasn't turned off. Sometimes the other piece of this, and you hear a lot, and I think there's a couple points here about extroversion and introversion. And I know Dr. Cherry and I have talked about this a lot. A lot of people that are high functioning anxiety, people often come across as very extroverted. They really have this drive and this ambition and want to perform really well. They may not actually be as extroverted as people think. And so this piece about energy and putting on the show is a big piece of this, because if you think about somebody that may not be a natural extrovert but feeling like they have to put on the show, if they don't recharge and come up with some, we'll talk about what that recharge looks like, but if they don't take some time to do some things to protect themselves from this high functioning anxiety, then it is very easy to tip over into an area where they are no longer functioning or maybe struggling a little bit more. And I do think the other thing that happens with those that are high functioning anxiety, especially in the workplace, is that often they can explain away, or people can explain away, things that are not going well. So this last point, you may even actually say, hey, things are not going well, or people are recognizing things aren't going well. Maybe it's tipped into the less functioning part of your moment. And I do think that it often gets dismissed because 99% of the time the person is incredibly high functioning, results oriented, and everybody just kind of, it feeds the whole performance culture of an organization. Everybody wants to keep it going and keep that person going, and acknowledging that maybe they're not as fine as they seem to be on the outside. It's tough. It's tough for everybody. It's tough for managers. It's tough for coworkers, those moments, because they may not be raising their hand and saying, I'm struggling, because everything else looks okay from the outside.
Mm-hmm. Just kind of talking through some of those specific things, whenever we're looking at the piece about, even whenever I was putting the final touches on this, like we're Dara and I are emailing back and forth last night or yesterday evening after 5. And it's like, and I'm typing out some of the things, talking points. And it's like, okay. And, we're just saying this, that we're, you're not supposed to be doing this after hours because this is what's going on here. So, I mean, it's just, it can feel like a very vicious type of cycle that just keeps going and keeps going and keeps going. But, some of the things that jumped out at me, Dara, that you were talking about with the ambitious part, the working long hours, are you working later? Are you starting earlier? Like talk about with 4 a.m. Are you the person that instantly responds to emails? Are you the one that send it out after hours and all of a sudden you get something that comes back? And it's like we tell ourselves that it's an issue that we're proficient, or that that we are just so on top of what's going on in life. But is that really what it is, or is it more of like a fear of control? Of something getting out of your control that's there. Dara, you have anything you want to add to that?
Yeah, and I think again it's something I've thought a lot about lately, and there's a difference between big C codependency and little C codependency. But that response and need to respond is definitely something I recognized when I heard somebody talk about how codependency was kind of revealing itself in their work life versus their personal life. Like, I'm so independent. There's no way I'm codependent. Like, what are we saying here? And then when I started realizing that my ability or inability to not respond to something after hours, or take a break, or walk away from my computer, those are just moments, exactly right, that you feel like you can't fail. And I do think the other piece that I think comes across, I mentioned perfectionist and overachiever and some of these other words that are often kind of the negative side of some of these things. And we've heard a lot over the last few years about perfectionism. And the other piece that I heard somebody say recently that really resonated with me was that if you assume that nobody can give you any critical feedback because you've said it all to yourself already, then man, what a barrier to any real growth or vulnerability. It prevents anybody from ever having that real conversation with you, because you're like, don't worry, I've already told myself all the negative things you're about to tell me. It's like a preemptive way to kind of protect yourself from those moments. But if we think about all these things, they all fit together really closely. And it's not, although we're saying high functioning anxiety, a lot of these things that we're describing, ambition, perfectionism, overachieving or achieving, these are all things that start to really tie together into a person's identity. And it's really hard to kind of pull it apart. Mm-hmm. Where does this identity come from? Why? And, even if you've done work and you've gone to therapy and you've done a lot of self-reflection, and I know, Scott and I have had long conversations about this kind of ability to think about identity and ego and self-reflection. Even if you've had a lot of that work and you've done a lot of that work, it is amazing to me, especially in the workplace, how often these things become rewarded and the cycle gets re-engaged because it's rewarded. You get career advancement, you get more money, you get lots of accolades, you get all the things. And then you finally take a step back and you go, well, hold on, what am I doing here?
What's it for? What am I doing with it? Yeah.
Yeah. Am I really finding value in this? So it is something that I know feels like, like you said, it is like this weird vicious cycle. But it is something that I think as a company, and as we think about how we think about moving this into the workspace and what this looks like in work versus personal, it is something that I think is important for employers and for us all to have some awareness around. Dr. Cherry, anything that you wanted to add to that?
Yeah, just hearing you guys, it makes me think of, so stress is really needed in our lives, right? If we had absolutely no stress in our lives, like for one, our bones would get very weak, like gravity pulling on our weight. So there is kind of this dose response with stress and anxiety that, helps an organism live better and be more productive. But there's kind of this, point or threshold by which you can exceed that. And there's a concern of, are you pushing yourself too hard for that short-term game at the expense of the long-term game? Like, one is, can you keep doing that level of activity and productivity, or will it eventually make your work suffer, or other components of your life suffer? So, this is really a delicate balance. And I know, Dara, you and I have had some discussions about like work-life balance. Is that possible? And so this is a very nuanced approach to, or kind of physical manifestations, mental health manifestations of maybe perhaps not being in balance from a high level.
We've seen some great comments that are coming through here, just asking about the connection of what we see, if we are aware of anything that is associated between things like anxiety and IBS, the irritable bowel syndrome. And let's see, I think Michelle was asking about some of the behavioral patterns with it being internalized. You're exactly right. All of these things that all of you have put here, and the piece about, ADHD. Dr. Cherry, do you want to talk about any of those, how maybe some of that works from a medical perspective on what's happening in the body when you have that kind of stress, how it can produce those types of conditions?
Mm-hmm. Well, it's pretty well known now in the primary care setting. Many visits, or maybe even a majority of visits, at least a plurality, so close to 50% of visits may have a psychosomatic component. So that means basically your mind affecting your body. And so when I went to med school, really there was this focus on mind, body, and spirit, and that you really need all three in balance to have optimum health. And so, for instance, as ADHD, or I guess we could kind of, Holly, was there a specific question about a diagnosis, or?
Yeah, Holly's cutting out just a little bit. There was a question about IBS and also ADHD, and ulcers and high blood pressure. Basically, just saying
pressure,
right?
Yeah, these physical manifestations of high stress, high anxiety.
So it's really important to look very holistically at yourself or at a patient, to where you're going to do a full medical examination depending on the complaints, but really a thorough history and physical or history as well. And part of the history is actually engaging into some mental health questions, which are really important, especially when you think of like ulcers and high blood pressure, where so for instance, in our clinic at one point, if people have to have their blood pressure taken to get their medical certificate for their truck driver certificate, a big explanation of high blood pressure used to be, well, I drove here, doc, and of course my blood pressure is, in stage 2 hypertension and things like that. But so that's a perfect example of how, external stresses from a mental health perspective can affect your physiology, so to speak. So, and I think it affects every organ system out there. So, we could probably spend all day just talking about that, but definitely your mental health is directly connected to your physical health. Even with cancer, if you have a lot of stress and it can actually really affect your immune system, and your immune system is actively looking for cancer cells. So, again, it's all types of metabolic cancer, cardiovascular, really across the board.
I know this is just like you said, this is a really exciting subject, and I think that we could really talk about it. And I think it actually goes into our discussion with Dr. Galpin the next time too, because in physiology and these other areas, a lot of it is they're just starting to really find out the relationship between some of the physical areas of the body and the mental areas of the body. So we know there's a relationship, like Scott said, that we know there's relationships between mind, body, gut, all the things. Gut feeling there's a reason we say gut feeling, but in a lot of ways, the research is still really early days, and we're learning things every week from these researchers doing really interesting stuff between all the different areas. And so, I think to the question, it's very clear that the two are very, very much related, both physical relating to anxiety and then vice versa.
Yeah, definitely. The other thing I was going to ask you about was at the very bottom, we talked about at the very bottom of that slide there, we had talked about feelings being dismissed by others because they don't see what we see or what we may be feeling. Could you talk a little bit about that? One of you talk a little bit about that, on how it is that, you may be feeling this, but because others don't see it, then they may not think that you would be in struggle at that point.
Mm-hmm. Yeah, I can speak a little bit about this. And actually, I came across a word a couple of years ago that just really hit me. It's called sonderer, which means someone who, when they look at another person, does not actually do this. Like if you actually think someone is doing fine, you actually recognize they may be going through very significant struggles. And I thought that was just a very interesting word. But what the problem is the outside does not match the inside. And so, for instance, a machine, any kind of machine has what we call a duty cycle. So it has so much productivity or output. But of course, you can ramp up the output. And, you see that in any type of performance racing where, cars or motorcycles or people, push themselves beyond what they think is capable. And with machinery, you see them fail, right? And so they're going way beyond 100% duty cycle. And I think that's the concern we're starting to see in our culture, where people are just pushing themselves so hard, although they're getting kind of the outcome that's wanted. They have so much productivity or performance. Internally, they're struggling. And so it's really it's really the worst case scenario, so to speak, because we do see people end up having nervous breakdowns or worse, taking their lives, where a lot of people say, oh, I never thought so-and-so was struggling. They always looked fine, and so something that we're specifically undertaking here at Axiom is just awareness of mental health, like awareness of symptoms individually and as organizations from an aggregate perspective, because if you're not aware, then you can't even act, right? And so I think all of us culturally have been raised to kind of just suck it up, so to speak, and just carry on. And, I think that is sometimes needed at times, but if it's a chronic expectation, we do see people starting to suffer, whether they know it or not. And so I think that's important, is having awareness of your mental health symptoms, because I think a lot of people are just totally unconscious of that aspect of themselves or others.
Absolutely. Yeah. And Dara, just to finish this piece out, you and I talked one time recently about, from a management perspective, of when you see that there's something wrong, you can sense that something is going wrong, but you ask them and they may first deny that or say, I'm okay. And I thought you had really great advice on how it was that you'd managed that in the past. Could you speak to that for a second as well?
I don't remember exactly what I said. Hopefully I get it right. So remind me if I get it wrong. I think that when I've had situations like that come up where I can tell something's not okay, or again, signs, recognizing signs like people who saying they're up at 4 a.m, worrying about a presentation. So, these are moments that I take as a manager to insist people take time away, and insist, even sometimes taking it away from the choice away from them, where I've said, you're going to take the rest of the day off, the rest of the week off. Nobody's going to call you. We're going to turn off your email. All the things that sometimes you have to kind of force people to do. But I also think I've really pushed people to have the conversations with me and feel safe having those conversations. So it's like, I actually have called it out a couple times where it's like, you obviously are not okay. I can tell something's going on. So talk to me about what's going on. But that you have to really have a lot of trust with somebody to push like that. Holly, did I specifically answer that, or was there something else I missed?
You did. And one of the things that really always stuck out at me is that, sometimes we feel like that's a protected health, medical type of question, but it's not protected. You can ask somebody, are you okay? And I think that that's what really needs to be understood within everywhere, whether it's work, whether it's, outside of work, whatever it may be. There is nothing wrong with asking somebody, are you okay? And that's the big piece that sometimes we see.
And I think, absolutely. It looks like we've had a couple questions about that too, about kind of where that boundary is, what you can ask, what you can't ask. We've talked a lot about this. Dr. Kurte brings this up a lot too, where a lot of HR people, even who you might expect to be more comfortable in some of these situations, but managers for sure often aren't sure how to ask questions or where the boundary is. Like you said, whether it's protected medical information, you don't want to people throw around HIPAA all the time. Where is that boundary? And it is always okay to ask if somebody's doing okay, or ask them how they are, and offer support.
Yeah, it's a big piece. Thank you. Thank you for speaking about that. Well, let's talk about some of the challenges then. And because this really gets confused. There's a difference between anxiety disorder that's diagnosed and high functioning anxiety. So Dr. Cherry, you want to talk to us maybe about where the medical piece of that is, why it is that maybe our numbers are off, or that could be underreported than what we realize is really occurring?
Yeah, and again, I think this is why I'm actually quite passionate about this topic, because, for instance, just like you said, high functioning anxiety is not a medical disorder. And so when a medical provider diagnoses an anxiety disorder, there's specific criteria, but from a high level, essentially, they're diagnosing low functioning anxiety. So you have excessive worry and anxiety that negatively impacts your ability to either work or in your personal life have relationships. And so really high functioning anxiety will never, or with the current medical standards, never really be diagnosed. And that's what we used also as the criteria to further evaluate someone. If someone basically doesn't have symptoms that cause impairment or the inability to do an activity of daily living, whether it's in, again, work, in the occupational setting, or in their personal lives, then, everyone feels from that perspective that that person's doing well. And so that's what's so amazing about this topic is, and with other medical conditions like diabetes, there are medical conditions that set up before you get diagnosed with diabetes. So you may be pre-diabetic, and even before you're diagnosed with pre-diabetic, you can actually do some labs that look at insulin levels. And so there's a continuum of disease for every disease process out there. And so really high functioning anxiety is kind of on this spectrum of an anxiety disorder. What's more troubling, though, is many people never get treatment or coaching or any type of awareness that allows them to kind of bring down those anxiety levels, because they are functioning well. And so that's the big danger there. And so, there's a ton of really what we call positive characteristics with high functioning anxiety that you're going to get actually, applauded for, promotions, bonuses, or just your own kind of self congratulatory, or things that make you feel good from a self-esteem perspective. So you're getting good results, you're on time, you're well organized, you're outgoing, you're proactive, you're helping others. And so you're really kind of this almost like a workaholic to a degree from just a very high level. But on the inside, if you have these feelings that are driving those behaviors that might make you, or are coming from where you're questioning yourself, or you're worried about the future, or I think what a lot of people do is they procrastinate, and then they have periods of intense work coming from that anxiety, comparing yourself to others. There's a classic statement. You don't want to compare yourself to another person. You want to compare yourself to today to yourself yesterday, because there are so many different confounders when you look at other people and try to compare, or you just can't relax and enjoy things, or you're just having racing thoughts or feeling of intimidation. I've in some ways, we've heard this topic called imposter syndrome, where you never feel like you're enough, and so you're just pouring energy into trying to prevent anyone from knowing that you're not doing what you should do, or you don't know what you are doing, and so you're kind of overreacting in that sense. So I'll leave it at that in case we wanted to further discuss something else.
Yeah. So in a situation like this, so maybe it would help if we gave an example. So I'll ask both of you this. So whenever from your perspective, we had to change our entire business there for a while. We went to COVID. Mm-hmm. Impacted you. Did you feel like that you all of a sudden had to quickly shift, and that like all hands on board, and everybody just pushed, did more than what you normally do?
Mm-hmm. You're cutting out a little bit, Holly. I think you asked about kind of the pivot during COVID. Mm-hmm.
Yes.
And bringing it to an example. So sorry, go ahead, Scott.
Yeah. From my perspective, one of the biggest challenges, just professionally, as I guided Axiom from the medical perspective, was we really needed to know, to do the best for our clients, we needed to have the best information, or we needed certainty around the disease of COVID. And early on, there was very little to be known. And so you really embark on very conservative measures to be as effective as possible. But yeah, I mean, it's kind of interesting you bring up that topic, Holly. I actually did not know you were going to bring this up, but it actually makes me think, was I filled with high functioning anxiety during COVID? That's a great example. And there was times where I did feel burnt out, probably. And, maybe I'll leave it to Dara from the business side, but I know the business also was pushed in so many different directions as well.
Oh, I mean, it's an absolute, yeah. I mean, no question about it.
Yeah.
I mean, I think like Scott said, there's a novelty about the situation, which causes a lot of stress and anxiety for people because it was a new experience for everybody, We didn't know what to do, how to deal with it. There wasn't testing available. What's our response? How do we help our employers? How do we help our own employees? And I do think that from the outside, so, you know, a lot of the employers I worked with and talked to on a regular basis, and sometimes this was on a Saturday morning or Saturday evening or Friday at 2 a.m. when they were dealing with the potential of plant shutdowns and outbreaks and all these things and not knowing how to handle this. You know, I felt a lot of pressure to be there for them because they were dealing with a lot of these moments and situations. And so just like for our own company, I felt a lot of pressure to be there for our own, our clients. And these kind of relationships are more than just a single work transaction. They're long years worth of relationships, but all of a sudden we're in this really chaotic, really anxiety building moment where nobody really knew what to do. And all of a sudden we're cut off from everybody. You're at home, moving to technology and all these things. And they did compound themselves. One of our listeners mentioned that she works for a community health center, a mental health agency, which treats individuals with anxiety or other issues. And she said since COVID, they've seen a huge increase in clients and a really long wait list. So even though they're encouraging clinicians and staff to practice self-care, just knowing that there's this wait list is causing anxiety because we know we can't get to everybody. And so that, I think for those of us in this healthcare space and knowing that we're here kind of desperately needed is hard. And I know, you know, early days, Dr. Cherry in the beginning of the conversation talked about his background, and it's really unique. It's got, you know, for a physician background to have occupational health and public health backgrounds, it's a really rare specialty. And when you have a situation with a pandemic and employers are working in this space to try to figure out how to deal with the pandemic, Dr. Cherry's background is pretty unusual to be able to kind of take all that learning and be able to support it. So there's only one Dr. Cherry, and there's only a handful of other physicians that have this kind of background. And I know the physicians out there that have this specialty were just feeling it. In addition to those that are in clinical situations and trying to help deal with the amount of effort there. But it's something that, yeah, I think is going to take us many, many years to kind of figure out what just happened and how do we deal with it. But yeah, absolutely. That's a great example, Holly.
I want to talk about workplace trauma. I want to make sure that we bring that piece in. But I did see Jennifer's comment that was asking about the link between social media and anxiety, and you had asked about teenagers, and you'd seen that had increased. And you are exactly right. I normally don't tell a lot of personal stories, but I mean, you know, just even in the last few weeks, I have a son that is a senior in high school, and you know, he'll be graduating in a number of weeks. And anyways, one of their classmates committed suicide, and it is all related to some of these things. And so, I mean, I get it. I hear you. I hear what you're saying, and you're exactly right. There is a link between some of those things, and I think that's all the more reason why we have to educate ourselves so that we can also help our kids.
Hey, Holly, just real quick on that note, you know, so everyone I think recognizes smoking is like a significant exposure for health risk, right? And obviously people still decide to smoke, but I think right now everyone is quite aware of that risk. Whereas, you know, if you look back 100 years, at one point smoking was kind of considered something healthy, right? It was a stimulant. I think even the military was issuing cigarettes for morale, you know, in the 30s or 40s, you know, 50 to 100 years ago. And then what was interesting is there was an awareness around physical activity or a lack of it. And so probably about 10 years ago, I was seeing corporate awareness programs that said sitting is the new smoking. And I remember talking to an executive at one point, just you know, very casually. We weren't really there to talk about that specifically, but that executive had a standing desk the next time I saw them. And I'll bring it home, though. I actually think in a number of years, they're going to talk about I mean, you guys already know where I'm going, I guess, but I think they're going to say social media is the new smoking. I mean, it's going to be, when you look at mental health and physical health, your risk of all of these conditions is going to be at the same, you know, almost at the same magnitude that smoking has on like heart disease and cancer.
Yeah, I'm laughing because I'm standing in my standing.
It's probably, I'm sorry?
No, I was just saying I'm laughing because I'm at my standing desk right now.
Oh, nice. Dara was not that executive, by the way. But yeah, I think that's something where with the awareness of your, I think the social media and the phone makers are actually coming up with awareness metrics. Like every week you get some screen time metrics. And again, that's our goal here at Axiom, is to provide awareness and actually a tool that can give you insight into your own personal resilience if that's where you think you need to go.
Yeah, absolutely. All right, let's wrap up here then and kind of talking about some of these practical solutions on how it is that you can manage this. Who wants first? Dara, you want to kick us off first, or Sherry, either one?
Yeah, I'll kick us off. Holly's got a model up here that I think is a great model, and it's the 5-4-3-2-1 technique. So especially when you're in a moment, and it's almost like if you're in the middle of having almost like a panic attack, but if you're feeling the anxiety levels raising, and we've all learned that breathing is critical, but the way that this 5-4-3-2-1 technique works is it kind of makes you stop and then very much focus on things. So you're supposed to acknowledge 5 objects you can see around you, 4 things you can reach from where you are, 3 sounds you can hear, 2 things you can smell, and 1 thing you can taste. So what it does is it makes you kind of go back to being aware of all of your senses, take a moment. And there's a lot of other tools like that with breathing and different ways of handling the moment. I just want to make one quick comment, and we've heard this from a couple of people in the audience, self-care plans. And I've thought a lot about self-care plans too. Yes. And I like to have, everybody hears me talk about my list. I have a list. So when I'm feeling really anxious or I'm feeling like my stress levels are increasing, I have a list that I always tell myself, did you work your list? And often the moments where I'm really stressed or struggling a little bit, I haven't worked my list. And my list includes taking a walk, rolling around with the dog, playing with the kids, taking a bath, reading a book. These are all things that are self-care, typical self-care things. However, I do think that we have to be careful about putting too much of this on a self-care plan or the individual, because for a lot of people, telling people that you're going to fix everything with a self-care plan is probably the wrong message, because it puts it back on the person to fix it. And if you're struggling or you need help, putting it back, another thing to add to your to-do list to try to be good at, is really stressful. And I'm half laughing. I'm not saying this to be facetious, but I do think that but being aware that this is not going to be a cure-all, that the line between knowing how to work your list like I do and knowing when to reach out to somebody and ask for help, there is a line there, and sometimes it's very, very hard to recognize it.
Absolutely.
Yeah, what I would like to add is kind of, I think the biggest high level, and I just actually said it, was coming up with a system or approach that you actually become conscious or aware of your mental health or behavioral health. And so, for me, for most of my life, I was not aware of, I knew I had bad days and good days. I knew I was more stressed out, but I didn't have a systemic approach to it, which now our lives are just so busy and so multifaceted that if you actually do not manage your life and your awareness of your symptoms or your mood or all of this together, it will sneak up on you. And so again, some people have more resilience, and so they can maybe endure longer. But another thought from a previous slide that I didn't mention was, you may actually be on the ragged edge of high stress, high performance, but you're managing, but then something happens in your family, right? And so you have a stressor in the family, extended family, finances, and that may push you over the edge. So you may be a high functioning person, but you don't feel like you're kind of in the red, so to speak. But if something else from another component of your life goes into a catastrophe or a major stressor, like that could push you over too. So we kind of approach it as having kind of like a dashboard. Many companies have key performance metrics, but mental health is so important. You really need to have a way to actually measure how you're doing daily, weekly, monthly. And so I think that's really the main tool by which will give you that insight into, hey, how am I doing today? Or how have I been doing the past 6 months? And how do I manage this for long-term health span?
Mm-hmm. Yeah, definitely. One of the things that we included on here that may have gotten your attention, where I put that section about schedule time to worry. I know it sounds counterproductive, but and you may have heard Dr. Curte talk about it before. But if you know that you have a time that's set down to where this is your personality type, and that you need to worry about something's on your mind, but you don't have time to deal with it right then. But you don't want to let that anxiety fill the rest of your day. Keep a journal that's there. Write it down at a later point in the day, and you can work on it then. It doesn't have to consume your entire day and take over what's going on with you. So that was another one that I wanted to toss out there too, about in addition to the staying positive.
Holly, real quick. I also just want to, these are all very individual responses and how to handle things. And I always go back to some of the comments we've had from the audience, and just thinking about the teams, our workplaces, these bigger groups. Because to me, if we can help a person, phenomenal. But if we can help a whole lot of people at an employer, that's really where the magic is. And I do think all these are great individual techniques. But one of the things we heard from somebody in the audience, I think this is a really great point, is a lot of people are trained to ask, are you okay? So a lot of managers hear that. You're trained. Hey, Holly, how you doing today? Are you okay? Hey, you don't seem to be doing that great. Let me talk to you. But when the person responds with something that's less than, oh, I'm great. Thanks for asking. We don't necessarily have the tools and the training to do the what then. What do we say next? How do we handle these really tough communication moments? Dr. Curte has brought the concept of mental health first aid training to Axiom. I think it's amazing. I will talk to anybody about it, but these are the types of shifts in thinking and training that if you work in organizations that struggle with those conversations, that's where I see the magic happening, because it's not just the water cooler talk that's like, yeah, how you doing? Let's just joke around for a second, but it gets to a much more real ability to help people. And you don't have to be a therapist. You don't have to be the one that has all the answers, but you know how to handle at least the tough conversations.
Not just know what to say, but actually practice it. When we went through that training, it was like we actually had to model that. We were practicing some of those things, and it's like you have somebody that unloads all that on you, and it's like, oh, what do you do then? What do you say at that point? So I think that is vital as well whenever you're putting some of those mechanisms in place. Absolutely. Anything else that you wanted to add, Dara or Dr. Cherry?
Yeah, I just wanted to mention one other thing, and we talked a lot about the physical and mental relationship here and long-term. We've had a few questions. Dr. Cherry, I want to just kind of come back to you about the long-term impacts of if you do nothing. So you've talked about maybe there being a tipping point, but have we seen any long-term effects of not dealing with the wrong side of anxiety and stress?
Yeah, I think with just off the top of my mind, when stress and anxiety are uncontrolled chronically, one, from a metabolic perspective, there's a chance for developing diabetes, because cortisol is our stress hormone. And one of the functions of cortisol is actually to liberate blood sugar or sugar from our body to get into our blood, because our body thinks we're trying to respond to an emergency. So if you're stressed out every day, that could actually affect your blood sugars, which that's kind of the definition of diabetes, is high blood sugar. And high blood sugar actually can really impact all your organs. So I think we know maybe friends or family that have diabetes, and it can affect their vision, their circulation, where they may need amputation. It's one of the major risk factors for heart disease is diabetes and kidney disease. So it's the number one cause for dialysis. I also think it's a major, or it is a risk factor for cancers, because cortisol and stress will depress our immune system. Our immune system are literally kind of the law enforcement of looking for foreign or bad cells. And, so we are developing cancer cells all the time, and our immune system will pluck them out and destroy them. And so, and I'm trying to think of maybe one other big topic probably just hypertension or high blood pressure, which is somewhat associated with, many other things like stroke and heart attack. So, the number one, most people go on high blood pressure medicine for there's not a known reason why you develop high blood pressure. It's called idiopathic, which means the doctor doesn't know. But maybe it is because of our lifestyle, right? I have some philosophical questions that I won't go into, but I've thought about this for years. Like, why do we have these disease conditions from no detectable issue?
Yeah. Two things I want to ask you about. I wanted to ask you first about workplace trauma. And so there was a question that was asking, is this the same as workplace trauma? Would you put this in the same category? Would they have the same type of symptoms?
I think this is a pretty nuanced discussion or topic, but, it probably depends what you mean by workplace trauma. So if there's, I don't know if they're getting at like hostile work environment, or if the person's work actually requires engagement in violent acts like the military or police, or someone who witnessed I've actually dealt with return to work from kind of all of those things. And some people actually never will return to kind of that same duty status depending on the severity. But, I think every case is different. But physiologically, you can think of it as acute trauma or chronic trauma. And it's either physiologic, again, from a mental health perspective, or is it from just a pure physical perspective? But physiologically, they are very similar.
Yeah. And Dara, didn't we have a situation recently where there was somebody that maybe had observed a motor vehicle accident? There was a workplace trauma there where they had witnessed something, and then they kind of suffered from some of those issues there that were associated with that exposure.
Yeah. We had an incident come through our injury hotline. So it was somebody that had witnessed a motor vehicle incident and witnessed coworkers being involved in a pretty horrific accident. And so it came through the injury side. So again, physical, this is the physical side of the business. People are physically dealing with a motor vehicle accident. And then we recognized, one of our nurses got the call and recognized that there was some other things going on with the employee, and passed it on to one of our nurses that's trained in mental health first aid. And so she was able to assess and help and provide the employee some resources. And I do think that kind of response is really important, because, we think the physical is so easy. It's there in front of us, but it's the other things that are going on that, like Dr. Cherry said, may make this employee may never come back to work if we don't address some of the other concerns. It has nothing to do with the fact that he can't physically do the job, but is he now traumatized enough that he's not able to come back to work? The person that asked about high functioning anxiety and trauma was just talking about, like, maybe at some point high functioning anxiety can lead to some PTSD type responses, and hence the kind of trauma connection.
Yeah, what I'll say on this topic is when you look at workplace injuries and workers' comp specifically, the research there, if someone is challenged with mental health issues, whether it's coming from personal, medical, or work-related, it really does change how a case is handled and how quickly it's resolved. And in family practice, really the standard of care is to always ask how someone is doing and do a quick mental health assessment. And so we're starting to see it be standard of care from the primary care side. And it's such a main driver on the workers' comp side. We're kind of building the case of why it's so important, right?
Yeah. Yes. And we are at 1 minute here, so we probably need to wrap up. But I think what stands out to me is that we're in the early days of this, and I think we just have to be honest that we don't have all the answers yet. None of us have all the answers that are there, but we'll work together on it, and we're going to have to as a society to move forward. Anything you want to add to that, Dara or Dr. Cherry?
No, just thank you, Holly, as usual, for the research and the work you've put in for this. I think it's a topic that we'll bring up again and again, and we'll keep. We really appreciate everybody's engagement. Great questions and comments from all of you, and it makes our job a lot easier because we can have a conversation here instead of lecturing to you about anxiety.
Yeah, I'll just kind of reinforce my push for awareness, so self-awareness, but also awareness for your colleagues, friends, and family. They may not see themselves, and so you want to make sure you're looking out for those in your network as well. Absolutely.
Paul, and I see your question that's right here. What we may do is we will get with Dr. Cherry about the falling asleep, and we will put together a blog post actually just for you to make sure that we get that answered. Thank you guys again for coming and joining us. We appreciate it. We appreciate your honesty, being candid, again, we'll continue to have these, and I look forward to seeing you at the next event that we have that we're workplace athletes training like champions. Thank you again for attending.